What if a patient is with diabetic ketoacidosis? So there are some questions. What is diabetic ketoacidosis? What causes DKA? What are the symptoms of DKA? Should I see a doctor or nurse? Is there a test for DKA? How is DKA treated? Can DKA be prevented? So the answers are diabetic ketoacidosis is a serious problem that can happen to people with diabetes. It happens when chemical called ketones build up in the blood. DKA can affect people with either type 1 or type 2 diabetes, but is more likely to affect people with type 1. Normally, the body breaks down sugar as a source of energy. For this to happen, sugar gets into the cell with the help of a hormone called insulin. If there is not enough insulin, or if the body stops responding to insulin, the blood sugar builds up. And that is what happens when a person has diabetes. If sugar cannot get into the cell, the body is unable to use it for energy, and this is how DKA can happen. When the blood sugar levels continue to increase and the body starts burning fats for the energy instead, burning fat can cause the body to make too many ketones and the ketone buildup, causing the blood acid level too high. DKA is an emergency and needs require treatment right away. What are the causes of DKA? So people can get DKA for a few reasons. They do not know they have diabetes, so they aren't taking insulin and their body starts breaking down fats. They have a major illness or health problem such as heart attack or infection. They take certain medicines or illegal drugs. They do not take their insulin as directed. Their insulin pump does not work correctly. Now the symptoms of DKA are feeling very thirsty and drinking a lot, urinating a lot, including at night, nausea and vomiting, belly pain, feeling tired or having trouble in thinking clearly, having breaths that smells sweety or fruity, and the weight loss. Should I see a doctor or nurse? Yes, you should see a doctor or nurse right away if you have the symptoms. Is there a test for DKA? Yes, if the doctor or nurse thinks you have a DKA, they will order several blood tests, including tests to check your blood sugar and ketone levels. They will also check your urine for ketones. Because DKA can cause problem with the heart, you might also need an ECG. This is a test that measures the electrical activity in the heart. Your doctor and nurse will also talk to you about checking your urine for ketones at home if you have type 1 diabetes. If your blood sugar gets above a certain level, if you are sick, if you have starting symptoms of DKA, you can buy urine test strips in a pharmacy or online, and some people use a meter to check for ketone in their blood instead of testing their urine. How DKA is treated? Treatment is usually done at the hospital. Fluids and electrolyte replacement. And insulin. When the body has enough insulin, it can cause sugar as fuel and it does not need to break down the fats. These treatments are usually given through a thin tube that goes into a vein called IV line. During treatment, doctor will do regular tests to make sure you are improving. These include blood sugar, other blood tests. This will be done about every 2 to 4 hours. They include tests to check your electrolyte levels and how your kidneys are working. Your doctor will also calculate something called the insulin gap. Can DKA be prevented? You can lower your chance of getting DKA if you take your insulin exactly as instructed. Measure your blood sugar often to make sure that it is not too high or too low. Check your ketones at home. If your doctor told you to do this, make sure that you know how and when to test and what to do if your level is high. Ask your doctor about sick day rules. If you have an illness like a cold or a flu, your blood sugar might go up and down more than usual. This means that you need to check your blood sugar more often when you are sick. Your doctor and nurse can tell you how to adjust your insulin dose based on your blood sugar level. If you are thirsty, drink fluids that do not have sugar. Sugary drinks like juice will increase your blood sugar level more. Thank you so much.